Now I am going to explain how to prepare leafy vegetables or vegetables. This is for all the incurable diseases, including kidney failure, liver failure, heart failure, stroke, etc. Firstly, leafy vegetables, in the sense saag, you have to put it in water for 2 to 3 hours, and after taking out, these leafy vegetables has to be added with pulses except horse gram and red gram, that is the lentils, remaining any pulses. And if you are interested to have potato, you can take potato also. Even chronic kidney diseases patients and diabetes patients, it's very important. Ratio, you should see that pulses should be not more than 5%. Potato a little bit. After boiling, you drain out the water, release it from the pulses and potato and leafy vegetables, saag. Thereafter, prepare masala, spices separately with tomato and all other spices, including garlic, ginger, green chilies, coriander, etc. And even the tamarind and tomato also can be used, even for chronic kidney disease and liver cirrhosis patient also. But that masala has to be prepared separately by using not more than half teaspoon to 1 teaspoon of edible oil or ghee or butter. After preparing masala, it has to be blended with the boiled leafy vegetables with pulses and potato properly. Thereafter, after taking the quantity required to the patient, then salt has to be added to the entire family members. The patient has to use 1 gram salt pocket for each meal. So like that, the leafy vegetable has to be prepared. Similarly, when you are preparing vegetable preparations, any vegetables, there is no bar with potato and pulses. As just now I said, less than 5% of the total quantity. Boil it, remove the released water. Thereafter, prepare masala separately by using all other ingredients: onion, garlic, ginger, green chilies and coriander. All these dry vegetables and vegetables are having a rich medicinal value, plus spices also. But for preparing that masala, you should use less than half spoon, teaspoon, even 1 teaspoon also no problem, for preparing that what we call tadaka or whatever the way in which you want. After properly preparing the masala, then you blend it in this vegetables which you have boiled already and discarded the water after boiling. So then once you blend it, then the quantity which is required for the patient you have to take out, whether it is a dal or whether it is a sambar or whether it is a sabji, whatever it is. So then you should put salt for your family members, and the patient has to use 1 gram salt pocket for the entire one meal. So like this, you should prepare for the all end stage disease patients, particularly kidney, liver and heart, etc. Please follow this for the preparation of leafy vegetables and vegetables. Thank you.